Hello,
Hi.
my name's Tristan. I'm going to be your nursing student for the day. I'm going to provide privacy as well as perform hand hygiene and stuff of that nature. So the provider has asked me to do an assessment on you. I need to do your head, eyes, face, nose, throat, all that good stuff, as well as a musculoskeletal, a cardiac, and a respiratory, and a neurological assessment on you.
Okay.
So I'm going to start off. Can you just tell me your name and your date of birth?
Dalen McDaniel, June 6th, 1995.
Cool, so it matches. And I'm just going to start out and I'm going to try to work my way down. So I'm going to start out with the top and go all the way down.
Okay.
So looking at your head, it's normal cephalic. There are no obvious injuries or trauma noted. I'm going to palpate a little bit. Just tell me if it hurts.
No.
All right, so no mass is felt, as well as the head does feel firm and all that good stuff. Next, I am going to, if you don't mind taking your mask off for me. I know COVID, but so your face looks fine. It's asymmetrical. No, it is symmetrical. So that means there's no deformities or one side looks opposite than the other. Next, I'm going to check your eyes. So I'm going to start with accommodation. So you're going to look at this pin, and as I get closer to your eyes, we're going to make sure your eyes can accommodate to the pin, okay? Alright, so accommodation is intact, and I'm also going to measure your pupil size, which, just looking at you right now, your pupils are about 4 millimeters. And lastly, I'm going to check for, to make sure your eyes are reactive to light, alright? So I'm just going to shine this light in your eyeball, and it's going to be a little bright, but just try to make sure that you don't close your eyes on me, okay? Ready? All right, cool. And the other side. So cool. So yeah, it is a little bright, but and it does, as this eye dilated, your other eye also went about 50%. So that is good. And if, sorry, have you had any problems with your eyes or anything like that?
Nope.
All right. What about a headache or any? Have you fallen, hit your head, or anything like that? All right, sweet. Next, I'm gonna ask you about your nose. Are you having any congestion or anything like that?
Nope.
All right. The external nose looks normal. No trauma or anything noted, and it does look midline. If you don't mind, we're going to check for nasal patency. So if you will squeeze one side and blow out, all right, and do the same thing the other. So everything's clear, everything sounds patent. So next I'm going to look in your mouth and make sure your gums are good, your teeth are good, your oral mucosa and things of that nature look good, okay? So just open up real big. All right, let me see your teeth. Sweet. All right, so your teeth are white, shiny, glossy. Your oral mucosa are moist, and your gums are good, so you have good dentation as well. Have you been having any dental problems, or do your teeth hurt, or
Nope.
anything like that? Sweet. And also, your throat looked good, and when I looked, your throat looked good as well. Your tonsils look normal size. There was no redness or anything like that. The last thing I'm going to check with your throat is your swallowing. So with that, we're going to make sure your trachea is midline with that. I'm just going to hand you a fake cup of water, and then I'm going to fill your throat as you swallow, okay? All right. So your trachea did feel midline, and you had no trouble swallowing. The next thing is your neurological assessment. All I'm going to do is just ask you a couple questions. The first question is, do you know how many quarters are in a dollar?
Yes.
How many? 4. All right. And do you know who you are?
Yes, Dalen McDaniel.
All right. And what's the date?
February 12th,
Yeah.
2021.
Sweet. And lastly, do you know why you're here in this room?
For an exam.
Yeah. Sweet. All right. And also I'm going to assess her glaucoma scale. I'm not saying. So I'm going to assess that, and the way we're going to do that is we're going to make sure her eyes are active, reactive to like my voice and stuff like that, and they are. So that's going to be a 4, and then next we're going to assess is she able to like obey commands, like as I'm talking to her and things of that nature, which you are. So that would be a 6 or a 5. And then lastly would be your motor function. So if you're you're able to do what I ask you. So your motor function's intact. So that would be a 6, which would mean she would have a GCS of 15. And so now I'm going to move on to your cardiac and respiratory assessment. All right. So I'm just going to feel your pulse just for 15 or 30 seconds. Alright, sweet. So I did feel your pulse and I counted your respirations as well. That's why I did go a little longer than 30 seconds. So your pulse is 72 and your respirations are 16. I know that because I multiplied by 30 for both of those. So are you having any chest pain?
Nope.
Alright, cool. So I'm going to start with our cardiovascular assessment and then we'll move on to our respiratory assessment, okay? So I'm just going to listen to some spots on your chest. Make sure you don't have any murmurs and stuff of that nature, alright?
Okay.
So I'm going to find the first spot on her second intercostal space. Alright, we're going to go over to the pulmonic. And then we're going to go down to the, I'm just going to go down to the herbs point, her tricuspid point. And lastly, her mitral valve. Alrighty. So I'm going to do the same thing, but this time I'm going to be listening for murmurs. So I'm going to flip over and use my bell. I'm going to go to the same spots as well, okay? One. Alrighty, so everything sounds good with your heart. I don't hear any murmurs or anything. For your pulse, it was 2+, which just means it's normal and it's to be expected. And also your heart, it sounded like it was beating pretty well. So next I'm going to go ahead and do a respiratory assessment. So I'm going to move to a couple different spots on your chest and then get your 2 lateral sides as well as your back. Okay. Every time I move my stethoscope, just take a deep breath in. If you start getting lightheaded or anything, just let me know and we'll stop, okay?
Attention all personnel. Attention all personnel. Code gray, ER86.
Okay.
Code gray, ER86.
Alrighty.
Code gray, ER86.
So take a deep breath for me. I'm going to listen to your right upper lobe, your left upper lobe, your left lower lobe, and your right middle lobe. Alright, and I'm just going to listen to your lateral side to listen for your right middle lobe. Alright. Your left lower lobe, and sit up for me. I'll do the same thing. Alright. And last one. Sweet, sounds good. Alrighty, so your cardiac and respiratory sounds are all normal, in normal range. We describe that as eupnea for normal breath sounds, so that's what you display. Next, I'm going to go ahead and check for any swelling and edema. This is also part of the cardiac assessment on your upper extremities and your lower extremities. So I did feel your pulse, but it was normal. It's 2+. And then I'm going to check for any swelling in your arms, and you don't have any. And lastly, I'm going to check for any capillary refill, which is normal bilaterally. And then I'm going to come down here and just feel for your pulses in your feet. Alright, and they're normal, and I'm also going to check for any swelling, and you don't have any. I can also feel the posterior tibial pulses, as well as the popliteal, and you also have your femoral pulse. So I'm not going to feel for those right now, though. But yeah, everything's looking good. You have no swelling or edema noted. The last thing before I get to the last thing, this is called an incentive spirometer. What we're going to ask you to do is take a deep breath every 10 times every hour. That way, just because as you're sitting in bed, you're going to get some mucus buildup and stuff like that. It'll help expel any of that, as well as we're going to set a goal for you on the incentive spirometer, and we're going to try to get you to meet that goal every. Of course, we want you to meet it by the end of every day. So I'll just set this over here, and then we'll get you started on that. Okay.
Okay.
And lastly, I just have to check your musculoskeletal part of the exam, and then we'll be done. Okay? I'll leave you alone a little bit. So I'm going to check both the elbows, both the wrists, both the knees, as well as the ankles, or the foot joints. So what I'm going to do is I'm just going to hold on. If you'll flip your arm this way, I'm going to feel for any crepitus or any anything like that. If you have any pain, just let me know. Have you been experiencing any pain in any of your joints lately? No. Okay, cool. All right, so go ahead and flex your elbow and extend. Flex one more time and extend. All right, there's no crepitus noted there, so I'm going to come over to the other side and do the same thing on this elbow. All right, and extend, flex, and extend. All right, nothing is felt. So I'm just going to move down to your wrist. I'm going to lift it up some. All right, so what we're going to start is we're going to flex it, and then we are going to extend it, and then we'll hyperextend. All right, one more time, flex, extend, hyperextend. All right, there's no crepitus or anything noted there. And last time on this one, so we're going to flex, extend, hyperextend, flex, extend, hyperextend. Sweet. All right, so I didn't feel anything. So I'll start with your ankle, then I'll go to your knee, because I'm going to get you to swing over to the side once we do your knee. So we're going to do the same thing. I'm going to feel your ankle, and we are going to dorsiflex your foot, so you're going to push up, and then we're going to plantar flex, and you're going to press like you're on a gas pedal. All right, one more time. All right, cool. And we'll do this ankle. All right, dorsiflex, plantar flex, dorsiflex, plantar flex. All right. And if you'll just swing over, just do your knees. So we have our knees in a dangling position. That way we can better access. I'm gonna move the camera a little bit. Sorry, all my viewers. All right. So what you're gonna do is you're gonna extend your leg, and then you're gonna flex it, extend it, and flex it. And I'm just feeling right below the joint of the knee. So you're gonna extend your knee, and you're gonna flex it. Extend your knee, and you'll flex it. Alrighty, so your exam is looking pretty normal to me. You said you answered no to all of the questions that we have. Your GCS is 15, all of that good stuff. So from my standpoint, you look good. So we'll let the doctor know all this stuff, and he should be in shortly, okay?
All right.
Do you have any questions for me?
No, sir.
Sweet. Thanks, Dalen.
Thank you.